Hello, my name is Dr. Stephanie Polmino. I'm a public health nurse, a gerontologist, a licensed nursing home administrator, and president of the Connecticut Nurses Association. I'd like to talk to my fellow senior citizens today about coronavirus disease, which is all around us and what we're hearing about all day long. I'd like to let people be aware that most people are going to come through this just fine. The senior citizens, people with underlying health conditions, people with autoimmune diseases are going to be more hard hit. We are going to have a greater fatality rate, and we're going to possibly be infected to a more intense level than many of the other people. But it's important to remember that many people will come through this of all ages and never even know they had it, and will not necessarily be aware that they have symptoms of it. So it's important that we all recognize the symptoms. And these symptoms can be anything as minor as a dry cough, a loss of the sense of taste or smell, a little bit of shortness of breath, and perhaps a temperature as low as 100.4. So those are the symptoms. If you have that, you need to contact your medical provider and get checked. And if you get a diagnosis of coronavirus disease, presumed or actual with a test, then we also need to be aware that if those symptoms progress, that we need to move to the next level of medical help. And a progression of those symptoms could include things like your shortness of breath becoming difficulty breathing, pain or pressure in your chest that's unrelenting, that might feel like a heart attack, doesn't go away. Also things like a bluish discoloration around your mouth, around your nail beds, or around your face, which is indicative that you're not getting enough oxygen. People could have some delirium or confusion. It might be difficult to wake you up or for you to wake someone else up. If these things are happening, that's very important, and it means that you need immediate medical attention. But before calling an ambulance or going to the emergency room, you need to notify the people that you either have a diagnosis of presumed or actual coronavirus disease, or that you have symptoms of it. Now, the next thing that's important to know is that you need a plan. You need to have a plan, and your plan should be in place already at this point. And your plan should include having information available for you if you need to call people, that you have your important contact numbers listed, that you have the list of local and your local neighbors, local family members, and distant family members who you want to keep in touch with, or who would need to know if something happened with you. Your doctors, your attorney, your banker, where is your bank? If you have pets, where is your veterinarian and what is their number? What pharmacies do you use? A list of your medications and doses and the times that you take them. You should have a go bag prepared. A go bag should include such things as a copy of your Medicare card, your insurance cards, copies of your living will, advance directives, power of attorney. Who are these people? How would somebody reach them? If you have an advance directive, what is your advance directive? What do you want done? As you go through from that, it's also important that you have a list of your information about what you need to have in your home, that you have your home properly stocked with non-perishable foods, with the products that you need, with over-the-counter medications for temperature control and bowel upsets, things of this sort. It's also important that you know that there are so many sources of help out there if you begin to become emotionally distraught over what you're hearing and what's happening. These are very difficult times, but if you can learn to reframe some of what you're hearing and seeing, and think of it in terms like, remind yourself that most people are going to recover from this. Remind yourself that we have so many people on the front line who are out there looking for us. Remind yourself that there are neighbors who will look in on you and family members who are calling. It's also important to recognize the signs and symptoms. If you're getting depressed or anxious and things of this sort, are you sleeping? Are you not able to fall asleep or not able to stay asleep? Are you not eating? Are you losing weight? Are you finding yourself feeling irritable when that's not normally your way, or feeling like you're jumping out of your skin, or having to pace around? There are so many things you can do yourself: meditating, deep breathing, relaxation techniques, getting out for a walk with your mask on, being protected, doing things of this sort. It's important that we stay connected with people. Even though we are isolated away from people in our homes, it doesn't mean we have to be socially disconnected for people. In fact, it's important that we not be socially disconnected. If you belong to church groups, social groups, other organizations, see if they have started groups where people can stay connected. There are all kinds of online things you can do. There are programs where people are working together in their own homes, doing things together. It's important to know that there are all kinds of resources: telehealth, telemental health, online support groups, all kinds of numbers you can call and places you can seek, and I've listed them at the back of my program here. So I want you to stay calm. Remember that a lot of things are within your control, not everything, but you're not alone. There are people looking out for us seniors. There are people who are available for us. There are people available to do shopping. So be safe, be well, and try to keep things in perspective.